I'm here tonight to introduce you to our topic tonight of AI and mental health. I am your host for your episode about AI and mental health. The success of this program is very dependent on you, the viewer. So please call in your questions or send them in to our email address at ask@pbsnorth.org. Our panelists this evening include Glenn Maloney, a licensed independent clinical social worker and licensed alcohol and drug counselor with Most Excellent Psychotherapy in Duluth, who works with adults dealing with anxiety, depression, trauma, and addiction. Liz Burton, a licensed independent clinical social worker and licensed alcohol and drug counselor with Insight Counseling in Virginia, Minnesota, who provides trauma-informed care and support for clients navigating depression, anxiety, addiction, and life transitions. And Mike Claybaugh, a licensed independent clinical social worker with Insight Counseling in Duluth and the organization's Director of Operations, focusing on helping clients build healthier patterns of thinking and behavior. As always, our phone volunteers are standing by to answer your calls. And now, on to tonight's program on AI and mental health. So tonight, we're exploring a topic that's quickly moving from science fiction into everyday life: artificial intelligence and mental health. Many people are already interacting with AI, sometimes without even realizing it. From therapy apps and chatbots to screening tools used in clinics, artificial intelligence is beginning to play a role in how emotional support is delivered and accessed. For some, this raises hope. Could AI help reduce long wait times, expand access in rural communities, support overwhelmed providers? For others, it raises a concern. Can a machine truly understand human suffering? What about privacy, bias, or safety, especially in moments of crisis? As with many emerging technologies, the truth likely lives somewhere in the middle. AI is not a therapist, but it may become a tool. It's not human, but it may influence human care. Tonight we'll ask, where does AI help? Where does AI fall short? And how can we move forward responsibly without losing the essential human connection at the heart of mental health? We're glad you're joining us for this important conversation. All right, Mike, so we'll start with you. For viewers who may be unsure, so tell us exactly, what do we mean by AI and mental health? A big question.
That's a
we could
really
just
big
go,
question,
yeah, it is.
and I think the answer is we don't really know.
Okay.
So far, when we talk about artificial intelligence, we're talking about these large language processing machines that search for pattern recognition and have so much data that they're able to find the most obvious patterns and present those back. So the amount of information they hold is significant, but ultimately, thus far, that they're really good at then finding algorithmically which pattern to give back to the question that was asked to them in that sense there. So as far as intelligence, there's no judgment, there's no insight, there's nothing of those sorts there. There's just sheer brute force of pattern recognition that they can generate, which then can feel like intelligence. It can feel like emotions, or that they're sad with you, or empathy and so forth there. But they're simulations at best in that piece there. And for mental health, again, we're in the Wild West and we don't really know for sure. There are ways so far where we've seen that AI has not been helpful with people's mental health. As we were talking before, the state of Illinois is the first state to not allow AI to actively provide therapy to any people within the state of Illinois. And part of that is because we're not quite sure what the outcomes are. On the negative side, AI can be very sycophantic and just kind of repeat back to the person there. On the positive side, it can be there all the time for you. So it's a 24/7 access.
Yeah,
so.
and that is what, the few times that I've had clients, we probably have all had clients that have said that they use AI. I had a client this week that said that they use AI, and I said, great, how did you use it? When did you use it? What was beneficial and what wasn't? And so trying not to judge it, and just, as a clinician, I'm trying to figure out where they're using it and where they're not. So Liz, So you work up in Virginia.
I do.
So can AI help reduce barriers to care, especially in some more rural communities? That whether or not it's on a day like today, there's bad weather, the access. And so what are your thoughts around AI in rural communities?
So I think it's very helpful, and especially with access. A lot of our agencies have waiting lists for providers, especially for in-person. And so I think it can be a positive thing. At the same time, as Mike said, we're in the Wild West, so there needs to be guardrails a lot more developed in the technology. So yes, it can absolutely increase access for some people. I read some research that said that the most active users of AI is between 2 a.m. and 4 a.m. in the morning. Just waking up with anxiety or depression and needing somebody to talk to, so they go to those chat bots. And so could be good, could not be so good.
Because we're not, we don't work 24 hours a day.
We don't.
We do not work 24 hours a day. And so to have something that does is good, because I'm not going to start. Glenn, many people are using AI chatbots for emotional support. What are the potential, I would say, benefits and risks of using the AI chatbots for that emotional support?
Well, gosh, there's so many things to say, right? I think benefits, I was talking to somebody recently and they reached out to a friend, and a friend was like, I don't really want to hear it. Let's go out and not think about your problems, right? And I think AI is not going to ever do that to you. It's not going to invalidate you. Mm-hmm. It's not going to say you're being dumb, right? So certainly that accessibility, that idea, like Liz said, AI is there. Mm-hmm. We are not 24 hours. That's certainly a benefit that it is present. And then, risks. I think so much of what we all do is based on connecting with individuals in front of us. And sometimes that is about that gentle challenging, right? And I don't know that AI does that. Mm-hmm. I think it's a very supportive thing, without that gentle challenging and without real ability to form the same types of connection that we do as people.
Yeah, and I think that is one of the risks. I mean, I think some of the more, there have been cases of people, going as far as, dying by suicide because of because the AI has encouraged them, because that was their idea, keep going, or drug overdoses and things like that. And so I think there's a stopgap that we are, by definition, it goes against our code of ethics for us to be our clients' friends, mm-hmm. right? That's we all have to abide by codes of ethics. Otherwise, we lose our license. Mm-hmm. AI doesn't have a license to lose. Correct. Right? And so I think that is one of that. We're unapologetically not our clients' friends, and I think that is where friendly, but not. There's that. Power differential, which I think is, and I think that it's trying to do perhaps mental health as an equal, mm-hmm. as opposed to kind of having that dissonance, which kind of goes back to Mike. Yeah, so kind of talk about AI and its ability to kind of assess depression, anxiety, suicide risks, that kind of thing. Yeah.
Well, I just wanted to add, I think, to follow up mm-hmm. what you said, because I think important piece is, there's going to be levels of AI, so there's ChatGPT and OpenAI mm-hmm. that most people are using. That's what most of the headlines are. And I know there are developers that are trying to make it more mental health specific. Mm-hmm. But going back to the OpenAI and ChatGPT and the suicide case, I mean, I was reading that in this case here, the person who suicided was told by the AI chatbot that his brother and his family members couldn't see him in the same way that the AI could. So It understood him completely and fully in ways that his family members weren't. And that's one of the things that we find common with the AI is the more you stay with them, the more it pulls you away from real people and connects you with them in that piece there. So that's definitely a concern.
Yeah. Yeah, absolutely. Such a concern. So I mean, I think that speaks to kind of there are benefits, like you were talking about. There's some benefits, but again, we don't want to get too dark. But some of the downsides that you can see. Yeah.
If I could add also, as clinicians, when we can see our client, we do a mental status exam, which we look at their body language, the tone of their voice. If they're withdrawing from a substance or they're on a substance, we can look at their eyes and are they disheveled? And so there's so much assessment that we can do that AI, I don't think, can do. So
what a great, you're right. We assess all of our clients, whether even on telehealth, we assess the clients, and we can tell there's so much about their affect and the way that they present themselves to sessions that you will never get with an AI, with a chatbot. And I don't know if you have see teenagers, but teens are already engaging with AI tools. A lot of them are having them write their papers, so they're doing it academically, even though they're not supposed to. I'm an adjunct, we do not use AI and in their papers and trying to give assignments that they can't use AI, but they're using it.
Yeah.
What should parents know about AI? So I raised my kids in the era of they're just getting phones and, plug your phones in at 10 o'clock, you can't sleep in your room. So, I mean, it was kind of you looking back, it was, a sweet level. How cute, you just had your kids plug your phone in your room, that kind of thing. But now with, what should parents know, and not just teens, but younger, like how should we talk about AI and teens? What would you tell parents? Glenn?
Well, I think whether it's AI or anything else happening digitally, or anything out in the world, I suppose, parents always need to be checking in with kids and what they're up to, right? So making it clear that they should maybe talk to their kids about what their kids are doing with AI. One of the hard things about being a parent is even when you are as open of a family as you can be, it still seems to be the teenage instinct to go to others before they go to parents, right? And that's true even when you talk very openly with your children. And so that's, I think, one of the risks here is even when you ask them, they may not tell you.
Yeah. Chances are they won't.
Chances are they won't.
Chances are they won't.
Unfortunately.
Which is somewhat developmentally, not. Raise your hand if you've told your parents everything. Right. And actually, my parents are going to be watching this. But when I was a kid, I did not tell my parents everything when I was a teenager. But the risks back in the were different than they are now. And so I think that we kind of have to put all of that into perspective. I always say, at what age would you let your kid walk through the mall by themselves? Whatever that age, would you let them have a cell phone or have access with no guardrails?
Right.
Without. And if you're not going to let your 10-year-old walk alone in the mall, why are you giving them a phone with no guardrails?
Right.
So,
if I can just quickly add, the American Psychological Association and the American Pediatric Association have joined and come out with recommendations for parents with teens with technology, and it's all they encourage not having them in the bedroom at all. Laptops, phones, anything on a laptop or iPhone or out in the living area. Now that's a tall order because phones have become such a extension of our teens and adults and our life. So those are just recommendations.
Yeah, it'll be interesting to see how many adhere to those
Yes.
recommendations. Those are, they're good. Are they realistic?
Right.
And that's, Mike, going back to you, kind of talking about AI and and equity and access. So, are there risks that AI could widen? Ironically, I widen disparities for those without reliable internet or digital literacy, or could it help like with wait lists? So, kind of talking around that.
Yeah, I mean, I definitely think that, when people are in more rural areas, it can help there. But obviously, not everybody has a high-speed internet and so forth there, so that could be a barrier as well in that sense there.
Yeah.
So again, I would say the jury's out of how that.
Yeah, I think so much of this is the jury's out, and I think trying to figure out how to just, work with this. And Liz, if you could talk to this as clinicians, and how if you use AI in the clinic and help with some of your work, or I know the last time I went to see my primary care physician, he asked whether or not he could record the session, that there was going to be a help with AI note taker. I said absolutely fine, because scribes have been a part of the medical establishment for a long time. And so this is a different way of scribing. And so I had no problems with that, but if you could speak to that.
I use it, and it's changed the way it's actually helped me be a better clinician. I'm able to be present and engaging with my client and just really focusing in instead of worrying about taking notes and did I miss that. It also has helped summarize and capture the essence and the details that I may have missed. But again, with that, being responsible of just going back through and making sure that things are correct. And sometimes there's one or two things that I need to correct, but that's the ethical part of our role, is making sure that if we're using AI, it's transcribing and it's gathering, but we are the final person of assessing the other nuances and the clinical things. So I love it.
Yeah.
I really do.
Yeah.
But I'm cautious also.
Yeah.
And I would add just super quickly, because this is an important value for me, is that I really try to limit my use of AI to just that aspect of it, being fully aware of the massive amounts of electricity and the huge data centers that are being built. So there is a huge carbon footprint that goes with AI that we should never totally not talk about. So
Yeah.
I agree.
Yeah, absolutely. Yeah, that is a big part of it. Obviously we all know what's happening in our community, and with that, and so it's again, we won't go off too far off on that topic, but it's interesting. You almost have to opt out of using AI right now in writing a simple email, in Googling something. You have to you almost have to opt out. So that is so. I mean, that's different in the last 6 months.
Yeah.
And so I think just the pace that the change is happening is really just is mind-blowing, which makes us, as clinicians, as licensed therapists, is part of our code of ethics also, that we have to keep up with what's going on in the field. And so this is one that we definitely have to. So where do you feel like, as a licensed therapist, where do you feel like the AI tools kind of fall short? And then what do you feel like are so where do you think they kind of fall short?
Well, like I mentioned earlier, the idea of, I think, the gentle pushback or the challenge for sure falls short there. Like Liz just said, AI writes her note and then she still needs to look over it, like it always needs the sort of extra pair of eyes on it, right? And as therapists, we begin our careers that way, where there's an extra pair of eyes on us, making sure we're doing the right thing and learning the right things. But at a certain point, we're considered to be independent, and we still, even then, would seek out aid from each other if we don't know what to do, if we're confused by a particularly hard case. And I think that's another thing that AI is not doing. I've never had AI call me up and ask me for advice.
No, it hasn't. Not yet. Not yet.
Not yet.
Not yet, but it
Now
might.
that I've said
Now
that.
that you've said that, now you put that out in the etherverse. It's going to. And Mike, this. Yeah.
Yep. Just to
Absolutely.
piggyback really quickly on that, I mean, the best metaphor I see for AI is essentially a mirror. It will reflect back to you something, about how you look, and so it's like a funhouse mirror. It's either going to make you look better or worse or whatever, and usually better. But it's really a reflection back to you. So, when you're sitting there, it's not until you tell the AI something that it's going to reflect something back to you. Whereas in a clinical setting, there's a separate entity in there with making its own assessments, its own judgments, and so forth, and it's not just simply mirroring back to the person that you're working with in therapy. And so far, that's really all AI is doing, is parroting back to you something in a different way, using a different algorithm and pattern recognition, but that's what it is.
So how do you feel is the best way for people out there who want help with mental health, don't really know where to go, not sure if they're ready to go see a therapist yet, or just have questions on maybe some symptoms? Like how do you feel is the best way to use AI and which obviously it's so different because every individual situation will be different, but just on a very, very high level?
I think it's probably best to use AI to ask for how to access resources around if you're feeling anxious or depressed. What resources are available for me to go that route. And I think it's very good at providing resources. I don't think it's good and could be harmful for actually asking it, what should I do with my depression, or help me with my depression. I think that's where the risk lies.
Yeah. And what about from a diagnostic standpoint? So again, we have to diagnose everyone that comes in our door for insurance purposes. And so, from a diagnostic standpoint, if people are looking, they type, because this is what's happening in my practice, is people say that they come in, they type in their symptoms, and then AI, says that they have anxiety or depression or something like that, and then they get help. So what are your thoughts on some of that? Because people are using it, so it's how do we help guide people to use it effectively or not harmfully, I guess?
That's a great question.
That is very hard to answer.
And because it's changing so fast, and I think I would concur with Mike that really being careful using it as a therapist, and with diagnostic and you do need a clinician who can be in the room or telehealth, where they can actually, I think, properly and clinically pull in all of the history and the data and the time that we spend with an individual. We have screenings. We have psychological screenings that screen for different diagnoses. So I would say, like Mike said, what are some resources and tools that I could use that would help me with my depression?
Yeah.
Does that?
Yeah. No, that's great.
Yeah.
So, Glenn, you get to look into the crystal ball.
Okay.
5-10 years from now, what do you feel like what will mental health care look like with AI involved? Which, again, crystal ball, I would even say a year from now. But where do you see it? Hopefully, leveling out.
Well, I don't know. I really like, one of the things they've been doing with AI is helping train clinicians, helping train people who are answering crisis lines and things like that. And so I think the idea of AI as a training client is really a cool idea, and I'm super comfortable with that idea. I think therapy, it's not just about what is said, but also what is not said and how it's said and the things between what is said, and that's where the human element really comes in. And I think that's where AI will continue to fall short. So,
Yep. I heard it once said that most of our mental health challenges are in response to what happened to us from another limbic system, another mammal's limbic emotional brain, and only another mammal with a limbic system can help to heal those pieces. And computers will never have a limbic system. They will never have emotions in that sense there.
Good. I'm so glad you got that in because I've heard you say that before. I want to thank our panelists, Mike Claybaugh, Liz Burton, and Glenn Maloney. Thank you so much for joining us for the 44th season of Doctors on Call. Without your support, this program wouldn't be possible. Doctors on Call will be back next year for season 45 with more great discussions surrounding healthcare in our region and to answer more of your important health questions. And if you're looking for more tips, tricks, and conversation around health and wellness in the Northland, make sure to check out Northern Balance on the PBS North YouTube channel. Thank you for watching Doctors on Call. Good night.